am the discussant for today's video discussion. So my discussion is all about learners with chronic illness like asthma and diabetes. I hope that you will listen and learn from my video discussion. So let's start.
Okay, so let me start with the introduction of my topic, which is the learners with chronic illness, especially asthma and diabetes. So, a chronic illness is a long-term health condition that may not have a cure. Examples of chronic illnesses are asthma, diabetes, epilepsy, heart disease, and etc. Students with a chronic illness may miss a lot of school. This might be because they need to go to hospital, recover at home, or attend regular medical appointments. Understanding the educational needs of students with chronic illness is essential if we are to provide equitable educational opportunities for them. Chronic illness can impact on every aspect of students' development, affecting academic performance, just like what I've said earlier, self-esteem, social relationships, and ultimately the ability to access the same education outcomes as healthy peers. Okay, so let's move on the content of my discussion, which I am discuss to you the two chronic illnesses like asthma and diabetes. So first, let's discuss, or I will discuss, the asthma or the chronic illness asthma. So what is asthma? It is allergic asthma, or it is a highly heterogeneous airway disease induced by exposure to environmental triggers and is characterized by airway inflammation, or AHR, elevated hemoglobin or Ig level, and airway remodeling accompanied by clinical symptoms such as wheezing, shortness of breath, chest tightness, cough, and restricted airflow. This is according to Tyler and Bonyavanich 2019. So, in addition, asthma is a condition in which your airways narrow and swell and may produce extra mucus. This can make breathing difficult and trigger coughing, a whistling sound when you breathe out, and shortness of breath. Asthma can be seen in any of life's stages, and it is one of the most common chronic diseases in the world. So let me ask you, who among you here has encountered a student or an individual with this chronic illness or asthma? How was the feeling? Moving on, let's discuss, or how does chronic illness affect the learners? We have these two effects. First, difficulty completing work on time or taking part in exams. Asthma is a leading chronic illness among children and adolescents. It is also one of the leading causes of school absenteeism. When children and adolescents are exposed to things in the environment such as dust mites and tobacco smoke, an asthma episode can occur. Uncontrolled asthma is a significant contributor to school absenteeism, emergency room visits, and hospitalization, all of which can lead to low school performance, financial burdens, and emotional problems for children and their parents. We also have decreased academic performance, difficulty participating in some school activities, for example, physical education or excursions. Asthma in children restricts the activities of school-aged children, such as participating in before and after school activity and extracurricular activities such as sports. Uncontrolled asthma has the potential to impact students' self-confidence and social interactions. Children with asthma and severe asthma perform slightly better in school than children without asthma when adjusting for measured confounders. So, as you can see, if you have encountered an asthma patient, yes. So, but on the other hand, the associations were attenuated in sibling comparisons. In contrast, children with uncontrolled asthma perform slightly worse. In addition, students with chronic illness or pain may have limited energy and difficulty walking, standing, or sitting for a long time. Some medical conditions may cause students to become dizzy and disoriented, or they may lack physical stamina. Thus, they may be unable to get quickly from one location on campus to another. Moving on to the second chronic illness that I will discuss is diabetes. So, what is diabetes? Diabetes is a serious condition where your blood glucose level is too high. There are two main types. First is the type 1 and type 2. Most children in school will have type 1 diabetes, which is a serious lifelong condition where your blood glucose level is too high because your body can't make a hormone called insulin. Having type 1 has nothing to do with diet or lifestyle. It just happens. We're still not sure what causes it. So now let's tackle the type 1 diabetes. It is a serious condition where your blood glucose sugar level is too high because your body can't make a hormone called insulin. So this is what I've said earlier. This happens because your body attacks the cell in your pancreas that make the insulin, meaning you can't produce any at all. We all need insulin to live. It does an essential job. It allows the glucose in our body to enter our cells and fuel our bodies. When you have type 1 diabetes, your body still breaks down the carbohydrates from food and drink and turns it into glucose. But when the glucose enters your bloodstream, there's no insulin to allow it into your blood cells. More and more glucose then builds up in your bloodstreams, leading to high blood sugar levels. We also have type 2 diabetes. Type 2 diabetes is a serious condition where the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. This means your blood glucose or sugar levels keep rising. We all need insulin to live. It does an essential job. It allows the glucose in our body to enter our cell and fuel our bodies. When you have type 2 diabetes, your body still breaks down carbohydrates from your food and drink and turns it into glucose. For some people with type 2 diabetes, this can eventually tire the pancreas out, meaning their body makes less and less insulin. This can lead to even higher blood sugar levels and mean you are at risk of hyperglycemia. So, what is hyperglycemia? Hyperglycemia is the technical term for high blood glucose or blood sugar. High blood sugar happens when the body has too little insulin or when the body can't use insulin properly. Moving on, how does chronic illness affect the learners? Diabetes can affect a child's learning because it can cause difficulties with attention, memory, processing speed, and perceptual skills if it is not managed. It, it is really important that the child is supported at school so they can manage their diabetes and get the most out of being at school. Some children with diabetes will have more absences than other students. Students may miss class occasionally due to exacerbations or flare-ups. Treatment schedules. Medical conditions including medication side effects can cause problems with fatigue and stamina, which can adversely affect attention and concentration. This won't be the case for every child with diabetes, but if they do take time off for hospital appointments or feeling unwell because of diabetes, it is important that they don't get penalized for this if possible. Everyday school activities can become complex undertakings. High or low sugar levels can happen anywhere at any time, affecting the child's learning, cognition, attention, and behavior. So, that's all. Thank you for listening and God bless.